Good morning. My name is Ramin. Talaie. I'm based in Brooklyn, New York. I'm here with Jocelyn, and our project is about the situation in Haiti. Thank you.
Jocelyn, Zuckerman, freelance writer based in New York.
When it's done, to be able to take the emotion or the impact of it.
We're hoping to touch a lot of different audiences and educate them about what sorts of emotional trauma comes after a natural disaster.
The issues are there, it's under the surface.
And we want to keep it on the public radar that these mental health issues are as important as physical issues and some of the other rebuilding efforts.
Okay, so I'm going to have everyone look right here. Great, good.
It feels really comfortable to be back here. The network is so supportive. The advisory panel and the other fellows and the fellows that have returned.
So it's been a great year. It's a good sense of accomplishment.
But our biggest challenge was actually selling these stories. A couple of the editors that we spoke to talked about Haiti fatigue.
As a result of the massive reporting that came after the earthquake.
So we had to sort of find creative ways into telling these stories. One of the things we did was an article for Yoga Journal that talked about a group called Nouvelle Vie that's working with teenage and Haitians, mostly in their 20s, on yoga skills and breathing methods to help with the stress and the trauma of their everyday lives.
I think it's difficult to place mental health stories, but I think there's an opportunity there because it's underreported. And because it's underreported, so you got to find that opportunity and sort of fill that niche.
We also did a story for Marie Claire magazine about gender-based violence in the camps and an organization called Kofaviv that's providing counseling and other services to affected girls and women. Putting a hard figure on the number of rape cases is a difficult task, as there is no comprehensive program in place to keep such records. Stigma and fear keep victims from reporting the crimes. A lot of the reporting was really difficult. When we went into the camps and spoke with girls who'd been raped and the dad of an 8-year-old who'd been raped, it was very tough emotionally to get those stories and to sort of process them. There were times when I think we were just overwhelmed and needed to walk away from the people we were talking with from each other maybe, and just collect ourselves a little bit and gear up to go back into it.
You're doing these stories because you're hoping that it would create it would make a change, and it does. I do see those small victories, and I do see those stories like these will make a positive change.
We definitely wouldn't have been able to do these stories without the fellowship program because they're so expensive to report, mainly. So it really gave us the basis to get down there and get some sense of what was happening on the ground and a sense of credibility. I think the affiliation with the Carter Center is something people respect.
So it's a long-term investment. We'll continue reporting on this. We'll start looking for those mental health angles in every story.
It's a matter of sort of being attuned to this and realizing that it affects almost all of us. So there should be no reason not to write these stories or sell them because they really touch us all, I think.